Jennifer Saine, BDC Vice Chair, who has touched every aspect of the planning and implementation of this forum, and Kevin McAvey, who inspired and developed tonight's program, and who will now be introduced by Jennifer Saine.
Thank you, Michael. On behalf of the Bedford Democratic Committee, welcome to Bedford. We are so excited to have so many of you here, and here at our home for our healthcare forum with the CD17 Democratic candidates. Our committee's job is to not only support our own Bedford elected officials, but to help elect Democrats all the way up the ballot. And this year will be so important with all of your help. Please keep showing up for your local committees and candidates and help flip the seat and get Mike Lawler out of office. Our moderator tonight is Bedford's very own district leader, Kevin McAvey. Kevin is a national healthcare policy expert and managing director at a healthcare consultancy based in New York City. In addition to his work with state and business leaders across the country to transform systems of health to deliver more effective, affordable, and quality care, he serves on several healthcare-related boards, including the Center for Improving Value in Healthcare, the National Association of Health Data Organizations, and the New York-based Schuyler Center for Analysis and Advocacy. He's qualified to do this. Please check out Kevin's YouTube page at Kevin for New York, where he's interviewed the candidates in his In the Field series, and on his Instagram, where he posts about this race and other local races, healthcare issues, especially Medicaid, and occasionally his wife and 3 kids. Welcome, Kevin, and let's get to the candidates.
Thank you. I mean, this is a tremendous opportunity, and I feel very privileged to be up here with all of you. And if any of you have seen the interviews before, I do think this is also an opportunity for all of us to get better educated on issues that are impacting all of our lives. So if you'll bear with me for a few minutes, I want to talk a little bit about healthcare in our country. And then I would like to turn the mic over to our candidates to talk about different aspects of health and healthcare, and how, if they served in Congress, they'd help us improve it. So thank you all for coming. It is my pleasure to moderate this discussion on health and healthcare in America, to discuss why, in a nation of such abundance, we have not yet had a crisis of conscience, to declare it an American right to be able to see a doctor when you are sick without fear of its cost. Each year in America, we spend more on our healthcare to get less in return. How many in this room have seen their healthcare premiums, copays, deductibles increase more than their wages in the past year? Raise your hand. Now, how many in this room have to wait months to see a doctor or specialist when they need urgent care? 84% of Americans are now unsatisfied with our healthcare system. 1 in 4 believe our system is in crisis, and no wonder. 23 million Americans are uninsured. Health insurance for an average family is $27,000 to cover less than it covers the year before. Healthcare costs continue to grow more than wages. 4 in 10 Americans have medical debt, and yet we face worse health outcomes, shorter lives compared to rich countries like ours. What we do produce in American healthcare is profits. One study found that healthcare system earnings will grow by 7% annually to reach $1 trillion in just 2 years' time. Another, the large for-profit publicly traded healthcare companies, found that publicly traded healthcare companies have extracted as much as $2.6 trillion from our healthcare system for stakeholders over patients in the past 20 years. And Americans of every age and gender, race and creed, and every party are increasingly unified in their belief that our healthcare system is broken and our leadership incapable of solving big problems like this. But more often than not, I will pose, it is Democrats who are willing to find ways to address the concern. LBJ, Medicare, and Medicaid that brought federal health insurance to the elderly and those of low income. It was President Clinton who signed the Budget Bill Act of 1997 that created CHIP, the Children's Health Insurance Program, a program long fought for by our neighbor, First Lady Senator Hillary Clinton, which reduced childhood uninsurance by over 60%. And it was President Obama who signed the Affordable Care Act into law in 2010, expanding Medicaid eligibility and establishing new subsidies for individuals to get access to coverage otherwise out of reach, halving the uninsured rate to an all-time low of 7.7%, despite Republican efforts to negate its effects. These were tremendous steps to fix our nation's very broken but foundational system of health, and I remind you that both can be true. How we should commend every policymaker that has sought to improve healthcare access and lower costs in this country, and also that we can believe that we are still not doing enough. Tonight, while Congressman Lawler and Republicans in Congress think about how we further divest our public and moral responsibility to improve our nation's health to a different and severe market, we will hear reflections from those on this stage on how they would fight for the public good should they be elected our next representative. I want to echo my thanks to everyone in the Bedford committee, including Michael Minard, our fearless leader. I want to thank the candidates for putting themselves forward at great sacrifice to their lives and livelihoods. It is an American sacrifice and one that should be recognized at every single opportunity. I also want to thank John Sullivan for running. Is he here yet? There he is. Stand up right there. You ran a campaign of integrity and character, a reflection of who you are, and for whom and for which we are all deeply grateful. I also want to take a moment to thank Congressman Lawler for his service. No. He's right, he's watching, he's right there. He is a man of 39 who must leave his wife and 2 young children each week to go to Washington to serve in this role. And for any in this room who have children, you know exactly what cost that comes at. Nearly 200,000 in our community voted for Mr. Lawler in 2024, 50,000 more than 2 years prior, believing that he would reflect our values in Washington. And this year, Mr. Lawler, with Congress on the line, with moneyed interests at his back, and no less than the direction of our nation at stake, will seek to make the case once again that he is best positioned to serve. But dollars are not votes, and rhetoric is not truth, and what has been going on in Washington does not reflect who we are. And it is incumbent on all in this room and all watching to make the case to those not here that there is a better way than the one that the president has pursued and Mr. Lawler has enabled at every step of the way. Let me show you. Every candidate on this stage, please raise your hand if you believe that every American should have access to affordable, quality health care. Please raise your hand if you will fight against fraud, waste, and abuse to ensure the integrity and sustainability of our healthcare system. Raise your hand if you believe that our healthcare policies too often reflect the interests of the system instead of those who depend on the system. Raise your hand. And finally, raise your hand if you will fight to improve the health and well-being of all Americans, rich or poor, young or old, new citizens of our nation, or a legacy of this nation's open arms to the tired and poor and persecuted. Raise your hand. This, my friends, is the way. So let's get to it. As I communicated to the candidates, I'll ask a series of questions, mostly those though not exclusively focused on health and healthcare policy. Candidates will be given 2 minutes for the opening remarks and varying limits for however we feel thereafter. There may be a period of discussion tonight where the candidates will get to choose which questions they respond to, allowing us to cover more ground and cover more of the over 100 questions that we received in advance of this forum. If a candidate is respectfully mentioned by another candidate, I may allow the mentioned candidate a 30-second response, otherwise ask that responses are held until closing statements. I may personally ask candidates to clarify or expand on their statements. No one has seen the questions for tonight. We have 5 candidates joining us this evening. I'll start with Beth Davidson, Rockland County legislator and former NYAC school board member. Where are you, Beth? Are you down there? Hi. Cait Conley, former director of counterterrorism at the National Security Council. We have John Cappello, former Air Force officer and senior fellow at the Foundation for Defense of Democracies. Mike Sachs, lawyer and former political legal journalist. I knew I was going to get shit from you. And Peter Chatzky, founder, CEO of a software company and deputy mayor of Briarcliff Manor in the blue. Not able to join us tonight, but sent a representative and materials, and I'll also be sharing a statement from her at the end of the candidate introductions. But with that, I'd love to pass, if we can, Mike, if you could pass up the microphone, pass it down that way to Beth. And Beth, I would love if you could start us off by introducing yourself, helping us to understand the experiences you have had in the please introduce yourself and help us understand the experiences you have had in the district that make you want to improve our healthcare system. Thank you, Beth.
Thank you very much. Thank you so much to the Bedford Dems for hosting us, to Kevin McAvey for moderating, and to all of you for joining us tonight. I'm Beth Davidson. I'm a mom of 2 kids. I'm a 2-term NIAC school board member, and I'm a Rockland County legislator who gets up every day ready to fight for the community I've called home for 20 years. Last summer, Mike Lawler voted for the big, awful bill, gutting our healthcare, slashing Medicaid, eliminating the ACA tax credits, and defunding Planned Parenthood. As a 2-time cancer survivor and IVF mom, I know firsthand what it's like to fight for the benefits that you need and deserve. And as a Rockland County legislator who also serves on the county's Health and Wellness Committee, I have a front row seat to the ways in which Mike Lawler's votes have destabilized our entire healthcare system. I represent healthcare workers in safety net hospitals who are terrified of losing their jobs. I represent people with special needs who are afraid of losing their healthcare benefits. I represent a county in which 1 out of 6 children don't know where their next meal is coming from. And I just sent a daughter off to college with fewer rights than I had at her age. When I get to Congress, I'm going to make healthcare a top priority. That means restoring the ACA tax credits and the Medicaid cuts and Planned Parenthood funding. But I won't stop there. We need to expand Medicare to include vision, dental, and long-term care and hearing care. And you can bet that as someone who's worked my entire life to elect pro-choice Democratic women to office, I will fight like hell until Roe versus Wade is once again the law of the land. If I leave you with one thought tonight, it's that healthcare doesn't exist in a vacuum. Housing is healthcare. Clean water is healthcare. Gun safety is healthcare. And yes, being able to access vital benefits without the fear of being snatched by ICE is healthcare. I have a record on each of these issues that I'm ready to take to Congress with your support. Thank you.
Good evening. I am Peter Chatzky. First, I want to thank everybody who showed up tonight. This is possibly the most important issue that we face today. It affects affordability, which is a problem throughout the country. Medical care is a right, and we need to completely throw out the current system. It's simply not working. I come to this with a very personal experience with our medical system. I have been a patient. I have been a dad of 4 kids. I have been a small business employer, and I have seen the impacts that our healthcare system has on families for 40 years. It is the second biggest driver of expense for a small business. Healthcare is a human right. Our country has to re-examine the way we look at it. We need to cover everyone. We're the only advanced country in the world that doesn't recognize everybody has a right to quality healthcare. It's critical that we not only improve service, but we have to bring down costs. It's the #1 cause of bankruptcy, personal bankruptcy in this country is medical debt. It has to change. So much emphasis on profits, so much emphasis on shareholders, on CEO executive salaries, and not enough on patient care. It's why I'm calling for Medicare for all and I will do all I can in Congress to see that that comes to be. Thank you.
Good evening, everybody. Thanks for coming. I'm Mike Sachs. Just over 21 years ago, my college roommate, his name is Greg Wolf, died of leukemia. He had the best insurance one could have. He had all of the care that money could buy. And yet, he died of leukemia. When he was diagnosed, he was actually in the UK. He enjoyed the services of the National Health Service there in ways that he might not have been diagnosed had he still been at home. And upon his diagnosis, he came home. He had the best care money could buy, great insurance. But I don't want to talk about how he died. I want to talk about how all of that allowed him to live longer than he otherwise should have. He was a junior in college when he was diagnosed. He came back senior year after undergoing intense chemotherapy and a bone marrow transplant, ready to be on the path to recovery and graduate with his class in a heroic effort. And we graduated sitting next to each other that summer. Had he not had the best healthcare money could buy in the United States and the best healthcare the country would provide in the UK, he would not have been able to graduate. He would not have survived. Had his family not had the means to provide that healthcare, his family, along with his 5 brothers and sisters, probably would not be enjoying the life they still enjoy today and remembering their brother and their son as someone who's able to at least live through graduation and die with dignity. There are so many people in this district and around this country that will not have that same opportunity. They will not have the best health care. They will not have the best insurance. They will not have universal health care. They will not have money that can allow them, even if the fight is a losing one, to enjoy the best possible care, to have as much time with their families as possible. So I'm in this race for Medicare for all. I'm in this race to ensure that every single person in this country, from cradle to grave, can enjoy the same kind of care that my college roommate did. Even if it wasn't enough to save him, it'll be enough to save so many other people. Thank you.
Good evening, all. I'm John Cappello. Kevin, thank you for putting this together. Thank you all for being here. This truly is the demonstration of what democracy should be. And I thank you all for coming out and spending the evening with us. As Kevin said, I spent 25 years in the Air Force. During that time, I had government-provided healthcare. And as a veteran, I still have that healthcare available. So to me, the idea that government can't do this is not true, right? Government can do this, but we have to make the decisions to get there. My entering argument is that everyone in this country should be covered by healthcare. Everyone, no exceptions. How we get there is a really, really important conversation, a conversation we have to have. And it needs to include costs. We haven't talked about that yet, right? But we have to, because we're talking about passing on a huge amount of debt to future generations. It's doable. I think it's doable, but we have to have a serious conversation on how we get from A to B. I've talked to many people around the district, like many of you sitting here in the room. Affordability, affordability, affordability. Healthcare, of course, is key to that. One gentleman shared $48,000 he's paying for healthcare with a median income of $80,000. That's almost half of his, okay, math. That's more than half of his income. How is that sustainable? Pay rent, food. It's not, right? And these are the conversations we have to have. And I look forward to doing that this evening with you. Thank you.
First, I have to just give Kevin tremendous credit for that opening, because I was ready to pick up that flag and follow you down the streets of Bedford. I think part of what we are talking about, Mike Lawler, is we as Democrats on the stage are articulating the values that founded this America and that is worth fighting for. And what we are talking about is not allowing the America we are seeing today to be the America that defines us. that addressing the problems that are impacting families across this community, across New York 17, and across this country. I am Cait Conley. I am a proud West Point graduate, Army Special Ops combat veteran, and daughter of the Hudson Valley. I come from a blue-collar family that goes back here 4 generations to my great-grandfather and grandfather who worked in the brickyard in Montrose, to my mom who's born in Peekskill, has been with the U.S. Postal Service for 48 years, serving communities up and down the Hudson Valley, to my dad who was a construction worker. And I will tell you, it is those values of hard work, of tenacity, of courage to stand up and fight for what is right that has guided me throughout my life. That's why as a junior in high school, when we saw the Twin Towers fall, I knew my place was in the fight. That's why I went to West Point, graduated at the top of my class, and then went off to serve 16 years as an active duty Army officer, doing 6 tours overseas to combat zones like Iraq and Afghanistan, leading America's sons and daughters in defense of this nation out of love. My last 2 years in uniform, as Kevin mentioned, I was at the White House as the Director for Counterterrorism on the National Security Council. And then I served as a senior executive for 2 years, working on critical infrastructure security. And I say all of that because with everything I have seen and everything I have done, I never thought I would feel like the greatest threat to America, to our future, would come from within our own borders. And that is what is happening right now. The country I was willing to die for is becoming something I barely recognize. And that is not okay. We are looking at an issue tonight that should be the right of every American. Affordable health care should be their right and not the privilege for just the wealthy few. And Mike, you have failed. And that is why we're holding you accountable. And we're working hard to make sure that people understand they deserve better.
So I have 2 questions that I want to kind of acknowledge in tandem. I want to ask about the safety net and Medicaid, and then I want to broaden the conversation to the rest of our population, many in this room who are feeling the crunch of healthcare, like many in America. The first part of the question, Medicaid. Medicaid, as many may know, is the payer of last resort in America. It allows the lowest income among us, children, individuals with disabilities, seniors, adults with low wages, access our healthcare system, to be able to see a doctor when they're sick. Nearly 77 million Americans are on Medicaid, including 6.5 million right here in New York. Medicaid is not a rich plan. It pays doctors about a quarter less than Medicare, which itself pays doctors on average at least a quarter less than commercial insurance. Per person spending on private insurance, just for a point of reference, has been growing on a per person basis 50% quicker than Medicare and Medicaid over time. And yet, last year, Congressman Lawler focused, along with other Southern Republican leaders, to vote on the One Big Beautiful Bill, which will cut over $900 billion from Medicaid over the next 10 years by making it harder for enrollees to get and maintain coverage, making it harder to get access to see a doctor when you're sick. 10 million more people are projected to be uninsured by 2034 because of the act. In New York, potentially upwards of 1 million. These offsets were used, of course, to fund historic increases in things like ICE, as well as $4.5 trillion in tax cuts, with $2.3 trillion of those tax cuts going to the wealthiest 10% of Americans. So Cait, I would love to actually start with you and walk back down. In approximately 2 minutes, can you talk to us about the importance of our healthcare safety net in America and what you would do to seek to strengthen Medicaid if you were elected?
Thanks so much. And so, you said something so important, which is we're talking about the American safety net. When we're talking about Social Security, Medicare, Medicaid, these are just the basics that many of these programs, every American's already paid into and they deserve. And when we talk about programs like Medicaid, these are just the basic things to provide to our fellow community members, our neighbors, to make sure that they don't go through suffering unnecessarily. Something that Mike Lawler seems completely okay with ensuring he's inflicting. When you look at the cuts that were in H.R. 1 or the One Big Ugly Bill, 25% of New York 17 residents rely on Medicaid. Over 30,000 of our neighbors are going to lose Medicaid coverage because of Mike Lawler. These things are not leadership. This is cruelty. These are things that I promise you, if elected, I will fight for every single day, because it's the right thing. It's the smart thing. It's the American thing. But those values aren't what guide Mike Lawler. Instead, it is his own selfish ambition, corruption, and greed. And the same thing with this administration. I was waiting for you to use the example of also the $250 million to renovate the Kennedy Center to mask the fact that no one goes there anymore. These are the real things that this administration, enabled by cowards like Mike Lawler, are prioritizing and are fundamentally wrong. You want to talk about how we should be talking about these issues? How do we make affordable health care available to every American? These are the conversations that we haven't been having as a real government that we must. And so that is what I will promise. I will tell you I will always champion. Let's address the actual problem. How do we expand existing programs to include things like having a public option? How do we drive down costs and increase competition? How do we check big pharma and allow, I always get the time sign. All right, we'll have more to talk about. But bottom line is there's a lot of things we should be doing beyond just funding these programs to actually address the root issues, to encourage more people to be able to afford healthcare and not need these programs.
So I'll actually like to, can you hold the mic for 1 second?
Absolutely.
This is how we're going to mix it up. So 30 seconds. I would love
So I don't
actually-
feel as bad that I went over.
For those who don't know, can you explain what the public option is and why it's a viable option?
Out actual insurance brokers, insurance companies, and allow people to pay directly for their actual health insurance coverage, cutting out the middleman. That's how you can drive down lower prices and greater competition in the market. And so it's that type of program that, look, I have concerns over universal health care, because if we had that today, you know who would be at the head of it? RFK Jr. But seriously. But I agree with my colleagues. This system is fundamentally broken. It is not working.
Thank you.
I think something that cuts across
the whole spectrum and all income levels is the fact that the cutting the ACA subsidies affects the whole system. It affects the whole system. How? Well,
who remains in the system, right? It not only makes it unaffordable for low-income people, but young people who feel healthy opt out. So the number of those in the system reduces, the number of those paying in reduces, and those who remain are paying way more, right? They're paying way more. So we have to incentivize to make sure that people stay in. And that is why the ACA subsidies are so important. So that is the first step to staunch the bleeding, right? That has to be addressed immediately. I mean, there's other things, reducing or capping how much of a person's income to about 8%, somewhere in there, right? I mean, we need to talk about that. Improving or focusing on preventative care, mental health care to prevent people from going to emergency centers. All of these things are practical steps over the longer run that will help as well.
I think a lot about power, not just policy. So my advocating for Medicare for all isn't just about good policy. It's
What is Medicare for all?
Yeah, it's an expanded version of the current Medicare we currently have that will be without deductibles, without copays, without premiums, and that reaches dental, vision, as well as medical from cradle to grave. It's an act that has 112 sponsors in the House and grows every single year as we reach farther in distance away from the passage of the ACA and the failure of the public option to be passed. And I believe we're in a completely different political era than we were in 2010, 2011. I believe we have seen too much to recognize that half measures and reforms won't stop fascism from knocking at our doors and coming into power. What does is policies that put us all in it together. Let's recall, you're talking about Medicaid, right? Part of the Great Society, Medicaid, Medicare. passed over the objection of those who thought it would be socialism. And yet now the heirs of the people who objected to Medicare and Medicaid claim they want to strengthen it, while of course slashing its money in the dead of night. Or they rely on the courts to strike down things that they cannot repeal because it'll cost them their jobs if they do so. If we pursue a policy that we can afford, not just that we can afford, but saves us money and saves us lives on the orders of billions of the former and tens of thousands on the latter each year, and every person sees their tax dollars, of which they pay fewer of per year than they would otherwise pay in premiums, deductibles, co-pays, and they see that it's working for them. If people like Mike Lawler try to repeal or slash, or people like RFK try to mess with what we all now cherish, all of our pitchforks will come out. We must turn the page on the era we've been existing in, have transformative changes like we saw in the Great Society and like we saw in the New Deal, so we can exit this gridlock we've been in and become, say, a 60-40 country, 65-35 country, even 100% to nothing country over healthcare. Thank you.
The microphone is always a little warmer when Mike hands it to me. It's really weird. Listen, everybody in this room will admit we're in a very wealthy part of the country. How many of you, show of hands, how many of you are directly impacted by Mike Lawler and supporting the Republican cuts, the devastating cuts in Medicaid? Show of hands. Okay, most of you got that wrong. 100% of you are affected. Medicaid is a primary funder of our hospital services. Westchester Medical Center, the only level 1 trauma center between Albany and New York City.
Trick questions aren't allowed.
Trick questions are? You said they were. Actually, what you said was they are not allowed, and the double negative confused the hell out of me. Medicaid works out, they pay the standard rates to hospitals. Hospitals can appeal. They can say, we're the only hospital in the area. We provide special coverage. And what happens when they appeal is their rates can go up. And you know what? There's a direct link between hospital rates going up under Medicaid and contributions to the congressmen in those districts. It's just another example of money in politics working against all of us. I am not a fan of a public option because it's a halfway solution. There's so much research that shows it doesn't help decrease the rate of uninsured. It doesn't effectively lower prices. Dems have to stop doing this. We have to aim higher. We have to swing harder. We need Medicare for all. Everybody needs to be covered. I also just want to point out Medicaid. There's been a lot of talk about how it cares for the least wealthy, but that's a problem with our system. Wealth, pre-existing conditions, whether you're employed or not, none of those should have any impact in one of the wealthiest countries in the world, making sure that everybody gets coverage regardless of any of those. That's why I'm supporting Medicare for all. Thank you.
I know. You and I both have this question. The question's about Medicaid, right? We're still there. Okay. And the reason I raised my hand, Peter, is, and thank you for asking that, and I knew it was a trick question, but I was ready for you, which is that I'm also impacted because I'm a county legislator. And part of the impact of the cuts to Medicaid and SNAP benefits is that crushing administrative costs and error rate costs, not to nerd out, get pushed down onto counties, which means we have to do more with less. So that's been a challenge for me from the beginning of this process. But I also want to tell a story. I know you want us to talk about our experiences in this district and in this community. One time I was taking my son in to get glasses at Lens Crafters. And as I was coming in, a friend of mine was coming out very quickly and just kind of said hi and looked very upset and kept moving. It wasn't like her. So I texted her later and I said, hey, is everything okay? And she called me and she said she was leaving quickly because she'd gone in to get glasses with her daughter. And they have Medicaid benefits, and that's how they got vision. And so the Lens Crafters person, said, "Oh no, don't look at those over there. You have to choose from these glasses." and set out, a box with like 4 different choices versus the hundreds my child got to choose from. There is a stigma to Medicaid coverage that we have to get rid of. And expanding Medicare to Medicare for All would certainly help address that. But I'm going to nerd out a little bit because since being a county legislator and since these cuts, I've learned a lot about Medicaid. Medicaid, yes, it is healthcare for low-income people, but it's so much more. It's supportive housing for people with special needs. It's transportation to jobs for people with special needs. It's so many wraparound services that make sure everyone in our community can live purposeful, productive lives. And that's why we reinstate these cuts, because the ripple effects are huge, not just into our healthcare system, but into employment, into our larger economy, and into the kind of country that we want to be.
So now lifting us up a little bit to other issues that also affect everybody in this room. Last week, the Kaiser Family Foundation released a new poll that found that just under half of adults in America find it difficult to afford health care. Nearly a third, or 36%, have skipped or postponed getting care due to cost. 1 in 5 have not filled a prescription. All while a Republican majority in Congress, as John noted, let the ACA tax credits expire. These are premium supports for individuals who make too much to qualify for Medicaid, but who do not otherwise have access to affordable health insurance through their employer, raising premiums for over 20 million Americans, often doubling the premiums that individuals face. Middle-class working Americans are struggling to afford health care. As Peter mentioned, employers are struggling to afford health care. As Beth mentioned, towns and counties and school districts are struggling to afford health care. So my question for you, starting with Beth, in approximately 2 minutes, how would you think about improving healthcare access and affordability, not just for low-income Americans, but for all New Yorkers who are feeling the crunch?
Sure. So, of course, it would start with restoring the Medicaid cuts, because as soon as we see people rolling off the ACA because they can't afford premiums, we're going to start seeing Medicaid services exploding. And as Peter pointed out, the safety net hospitals will really suffer. Dems often in Washington often struggle with messaging, and one of our biggest blunders on the ACA on the big awful bill was that rural hospitals would be impacted, and safety net hospitals would be hugely impacted. And we have 2 of those in Rockland County and others on this side of the river as well. Not to mention places like Open Door, which serves so many immigrants and other low-income people in our community. And because you have the Immigrant Protection Act here in Westchester, you hopefully have folks in the community, immigrants, who feel comfortable going to Open Door and the wonderful services they provide there, gynecological care, preventive care, dental care, all of it. And so I'm proud to have introduced our version called the Dignity and Safety for All Act in Rockland County, which will which will protect all Rockland residents from any county employees divulging data or information, including law enforcement, but all county employees, including the data that gets referred on healthcare and other nonprofits, so that everyone feels safe accessing every service they need in Rockland County. And then in terms of also improving access, it would be also repealing the Hyde Amendment and the defunding of Planned Parenthood. There are 4 states in this country that no longer have a Planned Parenthood clinic. And that means no preventive care, no STD testing, no, obviously, abortion care. And as I said, abortion is health care. And so restoring those funds will go a long way towards making sure women and men can remain healthy.
Kevin, the question was about affordability in healthcare, yes?
Yes.
Yes. So everyone's going to admit that the price, the increases in healthcare, just not sustainable. It's crazy. When I talk about Medicare for all, it's based on the notion, and you can find tons of studies here, $2 to $5 trillion of savings over the next 10 years. That's an unbelievable amount. If you just think that our current healthcare system is set up so that 80% of funding going to insurers is spent on patient care, that means 20% is going to marketing, to executive salaries, to equity shareholder payback. That's a lot of wasted money. I have moved all of my family's prescriptions to Mark Cuban cost plus drugs. If you're not aware of this, go home tonight, Google it. It's something is wrong when my insurance copay for generic drugs cost more than I can get mail order, literally dollars from this guy who just decided that the whole system's broken and he was going to buy a company and expand the company and fix that problem. I recognize that while I call for Medicare for all, we're not going to get there tomorrow. We're not going to get there in a year. So you have to have things you can do today to immediately reduce prices. There's no magic bullet. Nothing is going to bring the cost down 15% tomorrow. But there's a series of things you can do, 12 at least, that will each reduce the cost to consumers by 1%. There are things like changing how we deal with prescription drugs so that generic drugs that suddenly can treat something new don't burst in price. That's ridiculous. We should have site neutrality. There's no reason that a procedure done in a hospital where doctors get reimbursed 5 times as high as out of hospital. Why are insurance companies pushing people toward those procedures? There's no medical difference. If you did away with that, if you said it's illegal, you got to charge the lowest price, we'd save 1% instantly. There are 10 more I could name. I see time is up. I am passing the mic. Mike?
Peter? Even all those reforms that Peter mentioned at the federal level still will not occur until we take back both chambers of Congress and the White House. I'm for those. I think they're awesome, but we all know that. Or unless Mike Lawler decides to take more stuff away than say, I'm going to put a little bit back in your pocket. Look how much I'm helping you. Maybe the things that Peter mentioned are those things that you could put back in our pocket after you steal away Mike Lawler. Just giving you some advice. But we here in New York State have a trifecta. And we here in New York State have a bill called the New York Health Act, which, remember, Romney Care, and it was the predecessor in Massachusetts of what Obama ultimately adopted with the ACA, and then the Republicans said, oh no, that's socialism, even though Republicans started it and it developed at the Heritage Foundation. Yeah, we have our own thing here in New York called the New York Health Act, which is universal, single-payer, state-level Medicare for all. And we have the numbers, if we so will it, to get our Assembly and our Senate and our governor to pass, sign, and enact this into law. So to show the entire country what we are able to do here in New York is a pilot program for what everyone could have if we also will it. That's something we can do here. As a member of Congress, I would be more than happy to keep pointing to New York saying, look, guys, we did it. Look, we can do it. And point to those in the states that are not getting adequate health care, say, look what you could have if your Congress people and your senators were not hell-bent against depriving you of your health care in order to line the pockets of those who keep them in office. Part of what we have in the Congress is using it as a platform, using it as a way to pump our message out to the public and reorient our politics back to the people in the chamber of the government, federal government that's closest to the people. We have to reorient our politics back to the people and away from the billionaires that have wrested it away in order to keep themselves and their paid for politicians in office in perpetuity, no matter the people's will. Thank you.
So Mike, just for a 30-second follow-up, like, I mean, is there anything you think you could do in Congress without having a majority or other branches of government in control?
Yes, absolutely. Oversight. So we bring in the healthcare executives. We bring in the big money funders of those who have captured our politicians, and we grill them. We put their names to faces and make them celebrities to the American public as those who paid for the destruction of the Kennedy Center and the East Wing of the White House, and don't give a damn about the rest of our health care. That's one thing we could do if we just had the House. We have the Senate. We can pass, send things to the president, and when he dares veto them, then we again say, look what this person was bought and paid for to do against you. We are here to serve you. But then, yes, we can also use the bully pulpit to pass pass smaller reforms and hopefully get the vanishing level of sane Republicans, that's probably 0, to join us and help people. Thank you.
Thank you, Mike.
I think I want to emphasize something Peter said about site neutrality, because I think that's really important. Not only is it insane that hospitals charge 4 to 5 times more for the same procedures that private clinics or individual doctors do, that number, if it is brought to neutrality, could save up to $40 billion a year. If we reduce how much the hospitals cost to bring it to parity, close to $170 million, which pays for the ACA subsidies, right? So we're able to solve that problem or address that problem. You asked, and Mike touched on it, what could we do in Congress? And I think there's an example today, the Give Kids a Chance legislation was passed, right? And that, for those of you who don't know, this has been 5-year legislation to help fund child cancer research. And 5 years in the making, it was at the end of the Biden administration, it was ready to be passed. Of course, we know what happened. We had the knucklehead with the chainsaw on stage, and all of the things were cut. And so it languished over the last 13 months, and then came up in December. Again, Senator Sanders put a stop to that because he wanted it to be more inclusive. Long story, just a little longer. It was passed today, and I think it shows that as messy as our politics are, right, as messy as it can be, incremental change is still possible, and we are able to make progress. And so not only did that legislation pass, but the things that Sanders was pushing for, funding the centers, rural centers, ALS, NIH funding, all of those things were included as well. So we can make incremental progress. Yes, of course, we want to win both houses, but we have to keep fighting regardless, because there's opportunity.
Thanks.
So the first thing you have to do, I'm going to use an Army combat trauma analogy, is stop the bleeding, right? So if elected and they're fighting for you in the House, I will absolutely make the reinstatement of the premium tax credits, the restoration of Medicaid funding top priorities. I will absolutely fight to make sure we can restore federal funding to Planned Parenthood and making sure that this war on women's health care is stopped. This is wrong. But we have to go beyond that too. And some of this has to go back to unpacking, where did the problem start? When we passed the Health Maintenance Organization Act in 1973, where we allowed health insurance companies, you're surprised I knew that. I saw his face. When we allowed insurance companies to turn into for-profit entities, that is when we started to fail the American people, and we failed them for half a century. We do need systemic reform. But I think, to the point already made by both of you, we also need to focus on pragmatic solutions that are going to help American families now. Because the reality is, American working families cannot wait 4, 8, 12 more years for some magical solution. They can't keep their lights on today. They can't afford healthcare today. And so, yes, I do stand by pushing for things like a public option, which will guarantee a lower cost solution or option for people. That's why I will push to expand Medicare coverage that goes beyond just basic care, but also includes vision and dental, because it's your whole health. Like, these are some very common sense things that even with a Republican president, I struggle to even call him that, and even potentially Republican controlled Senate, like, these are pragmatic things that we can do that will impact people's lives in a real way.
So Peter hasn't changed your mind on the public option?
No.
Okay.
No.
Okay. Not yet.
Look, we got to deliver solutions. I do not want RFK Jr. making my healthcare solutions. I'm okay with that. The man doesn't believe in vaccines. Like, I don't want him deciding what healthcare I can and can't do. We've already seen, with the amount of control this administration has had, what they've done. They've waged a war on women's healthcare. We're talking about Planned Parenthood. Planned Parenthood Hudson Peconic has 11 brick and mortar clinics, 2 mobile clinics. In 2024, they provided over 94,000 annual health assessments, pre-cancer screenings, and basic diagnostic screenings to people here in our community. We're talking about a war on healthcare for working women.
And I do want to get back to women's health in a minute, because I do think that that is something that all of us are kind of trying to figure out how to grapple with.
Sorry, I didn't know the question, so I
No.
answered it early.
You were but I do want to kind of pick up on your cost drivers comment, and then I'd like to switch it up and move from Cait down to Beth, and then come back this way. Absent federal leadership, including a silent Mr. Lawler for the past 3 years, we have seen in America's healthcare system unprecedented consolidation among providers and specialists, among health plans and providers and pharmacy benefit managers, allowing private market giants to grow and extract ever higher service rates from employers, patients, and taxpayers. We have seen the increasing presence of private equity, pharmacy benefit managers in the market seeking to extract more dollars from our healthcare system with questionable claims of value, increasing denial rates for medically unnecessary services, the persistence of non-compete clauses for medical professionals, rising behavioral health and pharmaceutical costs. If you were going to pick one of these issues to tackle in your first year in Congress, what would that be?
What an easy list.
Yeah.
I actually think one of the issues that you somewhat touched on, but I would make a priority, is also going after big pharma in really tangible ways. Cost Plus Drugs by Mark Cuban is a great example. When you take out all of the BS and all of the smoke screens that are just focused around getting profits to shareholders and to executive suites, you see the actual cost of things. And you see that this doesn't have to be this hard. These types of programs exist that actually address the real issues, cut through the BS schemes, other things like pay for delay, where you've got brand name pharmaceuticals, after the patent expires, literally paying manufacturers of the same generic drug to not go to market. These things should not be legal. Pay for delay should not be legal. Like, these are real things that we can be doing that will actually drive down real costs for real families. And so sometimes I think we have to recognize that there are real tangible things we should be doing today that will make people's lives better. And if we can focus on that, these are things that don't just impact blue communities or red communities. They impact all American communities. And there are opportunities to move the needle and actually deliver solutions, even with this atrociousness in the White House. And even if we don't control the Senate.
Oh, if you could pass it back down to Beth, I'm gonna mix it up.
So I think the first thing I would want to tackle is the conglomeration of healthcare. You know, we're so worked up about which cable company is buying which, media empire and all the monopolizing we see in media, which is a real thing, and I don't deny it. But so many of us have seen our local hospitals, like Nyack Hospital, swallowed by a much larger system like Montefiore, which, I still love my hospital. But then you find yourselves in situations like when United and Montefiore's system was fighting, and I suddenly couldn't go to get my mammogram at the place that had been seeing me for 10 years because I was no longer covered. And then that went on for almost a year. So we'll continue to see, conflicting needs and conflicting ability to get the care that we need. So that's one thing we can, and when we know that private equity, another trend that we see, private equity is buying housing. Private equity is buying so many political firms that we see and marketing firms. Private equity is buying up now healthcare centers, and that needs to be regulated because they'll just continue to be motivated by profits rather than care. And that will continue to be a serious problem.
The lack of competition in geographic areas is killing us. And New York generally pays about 37% higher for healthcare than any other place in the country. I am not sure. I'm kind of torn between hating Con Ed more or less than Optum. Those of you who are lucky enough to get an appointment with Optum in the next year, the reason you're having such issues is that our Department of Justice, our FTC, they have no ability to break up those local healthcare monopolies. As Beth mentioned, the total focus of our antitrust law is transactional, and it's only because of limited resources. They go after the transactions that are hundreds of billions of dollars. A small healthcare provider that sells itself, lets itself be sold to an Optum, those transactions are tiny. It's a small doctor group that gets bought for a couple of $1 million. Nobody at the federal level cares about this. And then they do the next one. Then they do the next one. Then you have Optum. There is, without supply and demand here, if they control the entire marketplace, prices are going to skyrocket. We've all seen it right here. So I would look to change the antitrust laws to break these things up. Healthcare, not for profits or not, they shouldn't be getting an exemption when they are taking over control of an entire geographic area. That has to stop, and that's something I'd focus on.
Thank you.
Yeah, we're in a vertical integration doom loop with antitrust.
I think we should make
Lawyer there.
band name.
Yeah. But one ray of hope that I do have, where we currently are, is that Donald Trump, whether sincerely or not, has taken to attacking the health insurance companies with his own new, very nebulous healthcare plan, where he's going to put money in our pockets then to pay health insurance companies. But if we have the House, we can do more of what we saw AOC. Hey, Mike Lawler, I just said AOC. Do to a CVS Caremark executive during an oversight hearing earlier this week, where she explicated that doom loop I've been talking about. The connection with CVS owning Aetna, which owns the prescriber, which owns the pharmacy, which owns the drug maker, and keeps the customer in a constant loop. So you are a captive audience that they brag to about to their shareholders during their annual meeting. We can take that on. And I think there are elements, even in this administration's FTC, that would be looking to get a scalp for the people. So if we can find a way, and at the end of AOC's talking, she turned to her Republican colleagues and said, we can do this, can't we? And there were some heads nodding there. So if we can effectively, not by law, because we probably won't have the votes for that, but effectively through our bully pulpit and through our cross-partisan pressure towards the White House, say there's a political advantage here to at least doing a little bit of show to break these guys up to make people's lives more affordable. We can go to that. That can work. Of course, we'd work then to use that towards our ultimate reforms, which will change the political dynamic in our country so that there will not be another RFK Jr. in the HHS, because we'll turn the page on this doom loop that got us to our present moment. And they can then think that they at least made a little half measure to satisfy the rest of the people and keep us at bay. They won't, but we can find a way to meet halfway, or mostly our way, to get rid of these vertically integrated doom loops.
Thank you.
And I'm going to pile on. I like it. Vertically integrated doom loop. But the fact of the matter is, look, we need to address it. We see the consolidation in the information space and the media space. Whether I watch HBO, Hulu, Peacock, really that's not that big a deal, right? But with the obsession over shareholder profit versus the health of an individual, that's a serious conversation. There's a big difference. There's a big difference in not only scale, but morality. And we need to have that conversation, what that means. I think another piece to this too, and I hope is fraud and waste within the system, because there is. And I think addressing that aggressively will allow us to recover some of the resources that we need to address this bigger problem.
Terrific. Thank you. And let's go to Mike first. And I'd actually like to pick up on the women's health conversation we started earlier. In the wake of Roe versus Wade last year, Congressman Lawler voted for H.R. 1, which included a 1-year prohibition of federal Medicaid funding for organizations that provide abortions. Planned Parenthood. Mind you, no federal Medicaid dollars are used to reimburse abortion services. Planned Parenthood, however, is a critical health services provider, as has been mentioned several times, Beth, Cait, others, particularly for women across the country, providing access to STD prevention, prenatal and menopausal care, mental health services, preventive care like wellness visits and cancer screenings. While Congressman Lawler obsessively tweeted about Governor Hochul over 150 times in 2025, the governor, meanwhile, pledged to fill the financial gap caused by Congressman Lawler to Planned Parenthood in New York, pledging to cover federal losses caused by her own representative for the 47 health centers that serve over 200,000 patients each year. Unfortunately, other states could not do that, and according to Planned Parenthood, it had to close more than 50 clinics in 18 states this year. So starting with Mike and going down and coming back, how would you protect and support women's health, privacy, and bodily autonomy if you were a member of Congress? 2 minutes.
2 minutes. We have to make sure that the 1-year defunding of Planned Parenthood in the big ugly bill does not get renewed. If we control Congress, we can make sure that happens. We need to put in every single one of our legislation a rider that says the Hyde Amendment is repealed, so that federal funding can go towards abortions for women on Medicaid.
What is the Hyde Amendment?
The Hyde Amendment was an amendment put into place in the late 70s or early 80s by a lawmaker named Hyde. Jekyll, thanks. You beat me to it, Henry Hyde. That forbid federal funding to go towards abortions for people on Medicaid. And the Supreme Court upheld it in 1984, and it's been that way ever since. We need to repeal the Comstock Act, the 1873 Victorian era law that made illegal and criminal the mailing of abortion material around the country, which this administration, and if not this administration, then Trump's judges are trying to make alive again. That needs to get gone. We need to pass the Women's Health Reproductive Act. That will restore the protections of Roe versus Wade that the Dobbs Court took away. There's a whole litany of things that we must do. And we must go full throttle on that. Make sure that people understand that we are working for them, that women know we are looking to restore and strengthen the rights that this right wing has stolen. Not just President Trump. This was a movement. It is my day job to track all of the lawsuits that's been coming up from the right wing states, from right wing organizations like the ADF, to destroy women's reproductive freedom and abortion rights. We, the people, as made manifest through Congress, can do that. We can stand up for women's reproductive health and not give an inch, and make sure perhaps that nothing gets passed unless we get our way. Republicans try to play that hardball, we can play that hardball too. But the time of our playing on their turf is over.
Thank you, Mike.
Women's healthcare is healthcare. It's that simple. There are things that the government has no role to get involved in, and this is one of them. You know, we're no longer in the church we were in, so I can say they should stay the fuck out of this. We all got in trouble last time by getting too animated. We all forgot we were in the church. My wife, who's here tonight, served multiple terms on the board of Planned Parenthood Hudson Peconic. Coincidentally, I'm assuming she's wearing her 1973 shirt tonight, which I believe is the year that Roe v. Wade was passed into law, right? It is, I know I said it backwards, whatever. You know. It's just yet another example of the government getting involved in an area and imputing this morality that just doesn't make any sense. Treating any group of people differently regarding healthcare is wrong in this country. One of the things that all of the bills proposing Medicare for all specifically point out is that it covers, yes, dental, vision, hearing, but it also says women's health. And the Bernie Sanders version actually says the word abortion. We have to get over this as a country. These are medical decisions only between a woman and her doctor. And in Congress, I would do all I could to fight that continues. Thank you.
Thank you.
So this was one of our big fails last year in the race against Mike Lawler. He is the most radical, right-wing, anti-choice member of Congress this district has ever had. And he was not fully prosecuted for that record, going all the way back to the New York State Assembly. When we knew Roe was going to fall, the New York State Legislature stepped up and passed 6 bills to protect access to abortion care for women in New York State. And Mike Lawler voted against 5 of them. That includes the Equal Rights Amendment, Prop 1, that we all passed last year. Yeah, for Prop 1. Long before it comes to us in the ballot box, it had to be voted on by the Assembly. Mike Lawler voted no. It also included the law that said that you can't, a state where abortion is illegal can't extradite a doctor in New York State for providing abortion care to a patient from the state where that's illegal. That really happened. There was a New York State doctor that is the sister of a supporter of mine who was attempted to be extradited by Texas and Louisiana for providing medication abortion to a woman from to women from those states where it was illegal. So that's really happening. If Mike Lawler had his way, she'd be sitting in jail right now. And so we have to be real about who is sitting in Congress now and why he needs to be gone. What I'll also say is that we can pass the Women's Health Protection Act. It's been passed by the Senate. It's been passed by the House and could be passed in the Senate, of course, if we didn't have the filibuster. Again, it goes back to restoring Medicaid funding. Half of all American babies are born to moms who have Medicaid. And so if we want to, continue to have healthy babies, we already know there's maternal mortality discrepancies between white women and women of color. That's something else we have to look at and study. And finally, yes, we have to get rid of RFK Jr. tomorrow. The man doesn't believe in the HPV vaccine. He doesn't buy that it actually decreases your risk of getting HPV and thus cervical cancer. And the last thing we want to see is cervical cancer rates and deaths going back up. So these are, just a few things that we have to do, but it starts by reminding people how anti-choice Mike Lawler is, and then and then he should no longer be our congressman.
Thank you.
Thank you.
John.
Look, women deserve the best health care, full stop. I mean, we all agree with that. I agree with everything that's been said, fully fund and expand, in many instances, Planned Parenthood. However, this isn't just a political issue. This is common sense. It's healthy mothers and babies make for strong families and communities, right? Fully funding women's health care across all income levels allows them to remain in the workforce should they decide, keeps them out of debt, and keeps the government out of the decisions about their health care. And at the end, that's it. That's what we should aim for.
Thank you, John.
So I have lived through what it looks like when government determines what your health insurance does or doesn't cover during my time in the military, where I was on the military insurance plan that is TRICARE. And I will tell you that it led to things like I had to wait years to be able to freeze my eggs because I couldn't afford to do it because TRICARE didn't cover it, right? We have seen where healthcare plans don't make women's healthcare a priority, even if they have insurance. So let's also be real. It's not just about getting insured. It's about, do the insurance plans actually make healthcare that you're seeking affordable and available? But I want to also comment on, Mike, something you did while I was still in uniform, which was vote numerous times to deny women in uniform the right to access abortion care that's covered. women who were serving, women who went to combat and fought and sacrificed for this country. You had the audacity of denying them over 11 times with your voting record access to abortion care. His record speaks for himself and speaks for who he is. On his watch, we've allowed the war on women's health care to continue and to get worse. It needs to end. If I'm your representative in Congress, I will fight like hell to codify Roe v. Wade, to make sure it is law, to make sure that women, regardless of where they live, have those basic rights and accesses, and that it is only them and families making decisions about family health care, not the government, not RFK. These are the core concepts that we must fight to make real. And that will never happen with Mike Lawler in office. I do agree with Beth. We need to hold his feet to the fire, hold his ass accountable, because what he's done is betray the American people.
Let's keep with you. So over the past 10 years, there's been a growing awareness of the impact of social determinants of health on our well-being. You can't fill a leaky cup. You can't treat and release an individual who is sick to a homeless shelter expecting them to get well. You can't expect children to thrive in an environment where there are safety concerns, food insecurity, housing instability. And yes, we cannot thrive if we are not consuming healthy food, have access to clean air and clean water. In 2 minutes, where have you seen the impact of the environment on health in our district? And what would you do in Congress to improve whole person care?
So I think we have seen how health goes beyond just insurance, right? What you're talking about is, look at the EPA. We have PFAS issues in our drinking water all across this district, literally in every one of the 4 counties, in every corner. Yet, under this administration, we watch the EPA roll back the classification of 4 of the 6 most dangerous forms of PFAS chemicals from being something that is prohibited. To your point, I mean, look, I grew up swimming and fishing in the Hudson River and eating the fish at a time where we're debating whether or not to dredge it. You know, where's Riverkeeper? Every time I tell the stories, they look at me like I've got 3 heads and they're like, how are you still alive? You know, these are real things. So yeah, the environment absolutely impacts what happens to us. Just watch Erin Brockovich, you know, great movie, go Julia Roberts. But it goes beyond that too, to be honest with you. It is also the structures in law that allow families to take care of one another, like the Family Medical Leave Act. You know, I had 4 major surgeries due to injuries sustained while I was in uniform. My mother was able to take FEMLA and care for me because I couldn't care for myself. Those are incredibly important protections that are also part of overall healthcare and health and wellness. You know, the Healthy Families Act, which has not been passed, is something that would guarantee 7 sick days so people couldn't get fired for missing work, regardless of the type of employment. That's still not a law. There are very basic structural things across government that we should be doing to allow people to have the structure for basic well living, because this isn't just about insurance anymore. It's about all the things that drive someone's health and how to take care of it.
I think it's clear that health of the Hudson is a major concern for us all in the district. Like Cait, I remember boating and fishing and swimming. And I remember when you could drink water out of the faucet without really worrying about it. People
blow at night?
There's a few other reasons, but these things are no longer possible. And part of it is making sure we hold those accountable that caused this and hold their feet to the fire, make sure that the cleanup that is necessary is not only paid for, but accomplished. And it's drug on for way too long. I think there's a lot of community, and Cait alluded to this a little bit, there's a lot of community level organizations that are identifying important, I mean, the ALICE report that the United Way puts out. I think that's a really important asset to help to identify the challenges at the local level. Because at the end of the day, our job as a member of Congress will be to make sure that those organizations in this community that have identified challenges and that are working on their challenges are fully funded and fully supported. Because who better to deal with those challenges than those who are dealing with them on a daily basis? And I've been super impressed with many of the organizations I've come in contact with across the district. So making sure that they are supported is key.
Thank you.
Immigration policy is also health policy. Mr. Lawler has been talking about ending New York City's sanctuary status so that the law enforcement there can work with ICE to not get out the criminals, but terrorize people who are looking to make a better life in this country and our neighbors and contributing to our tax base. If those people feel terrorized and feel like they must reside in the shadows or in the basements or hide in the homes, as we're seeing in Minneapolis and even in Ossining, what's going to happen when they get sick and they're afraid to go to the hospital? What's going to happen when their kids are starving because mutual aid doesn't come to them? That goes beyond the household. That reaches broader community. Beyond that, we got this measles thing going on now. Thank you, RFK Jr. He's our punching bag this evening, beyond Mr. Mike. We are now having the return of sicknesses that we have not seen in these numbers since we eradicated them. Polio now is back in play. This comes from environmental factors as well, from education, from political, isolation, to buying into misinformation that spread like wildfire through the pandemic. So environment read broadly, yes, PFAS, yes, Hudson River, yes, get rid of the pollutants in our air that this EPA is looking to feed back into our lungs, but also environment in which we live in, our communities. We need to right size our information intake, and we also need to right size our humanity. And that's cross policy across the entire federal, state, and local understanding of how we can better our communities.
Thanks, Mike.
Yeah.
The number one threat to our environment in this country is Donald Trump. Every one of his policies is reversing the progress made by previous administrations. You want to get the environment back on the right track, get rid of Donald Trump. It's pretty easy. He's a short-term thinker. All he cares about is reducing, having an impact short-term with no vision, no investment in the future of America. And it ties in to how this country currently looks at healthcare as well. We are the number one country in terms of treatment. It's why people flock here from all over the world to get treated. We're nowhere near number one in terms of prevention. And unfortunately, our healthcare system, because it's based on treatment and not prevention, is incredibly expensive. It's far more expensive to treat a problem than it would be to prevent the problem. So we have to look at our healthcare system completely differently. Nutrition, exercise. Who remembers the presidential fitness test where you had to run laps and stuff? I hated it as a kid, but I'd probably be in better shape today if I actually put more effort into that. Who remembers when the food pyramid went the right way, when it wasn't upside down? These are all things that have happened recently, and we need to get a way more holistic look so that we're spending less money because we're spending it too late.
Can I clarify, do you mean actual physical environment or like the environment?
Physical environment around you, inclusive of the environment.
Okay, so I will address the environment because as the environmental chair of the Rockland County Legislature, I do get to help shape policy that does have health determinants. I was at my brother's birthday party over the summer. It was at a house on the river that connects to the lake where we grew up and also swam in every day. And looked across the beautiful river at about 5 or 6 factories on the other side, spewing smoke into the air. And I thought, that might be why I had thyroid cancer and why my sister has hypothyroidism and my dad had thyroid cancer. We can't deny the impact that water and air in our environment have on our health. And so when the federal court announced over the summer that it was overturning the Save the Hudson Act, which was passed by your own Senator Pete Harckham and Dana Levenberg, to stop Holtec, the company decommissioning Indian Point, from dumping its radioactive water into the Hudson, because we know that no amount of radiation is safe for the human body. I immediately called a press conference, stood on the Haverstraw Bay with about a dozen activists that I've worked with over the years, along with elected officials, and called on the governor and the attorney general to appeal that decision without delay. And within 48 hours, we heard from both offices, with the extra from Governor Hochul, that she was not interested in restarting nuclear at Indian Point, which I think is good news to all of us. Thank you. I'll also say that, since I don't know if we'll have another chance to address it, is that a way that we can fix the environment, especially for our children. The #1 killer of children in this country is gun violence. And so one big preventive care measure we can take is passing an assault weapons ban, getting weapons of war off our streets. I can't do that as a county legislator, but what I did do is pass a law requiring signage of the additional risks of having a firearm in the home, of suicide, homicide, accidental death of a child, or domestic violence fatality. When I see problems, I stand up and fix them, unlike Mike Lawler, who prefers a strongly worded letter. Thank you.
Thank you. Thank you. So we have one more question, 1 minute each, and then closing statements, and we can actually keep it with Beth. So according to the New York Times, the CDC, arguably the world's leading public health agency, has shed 1/3 of its staff since Mr. Trump took office. Last week, the U.S. officially pulled out of the World Health Organization. In January, the CDC, in what the Hill called a seismic shift, reduced the number of vaccines recommended for children, which forced the American Academy of Pediatrics to publish a competing vaccine schedule, calling the federal recommendations dangerous and unnecessary, which will sow further chaos and confusion and erode confidence in immunizations. And it has. Childhood immunization rates continue to fall nationally. In 2025, measles cases in the US, as Mike was mentioning, exceeded 2,000 for the first time in more than 30 years. Whooping cough is now a case epidemic across the country. All the while, Congressman Lawler has said little and done less. How can we build back trust in our public health system and science-based research? In 1 minute.
It's getting to be such a tired answer, but fire RFK for starters. Look, as a school board member and mom, this is very personal to me. My aunt had polio. Like, this is not so long ago. And when the measles epidemic happened in Rockland County in 2019, it was a serious problem that came with a nice side effect of anti-Semitism, because it was primarily in the ultra-religious, ultra-Orthodox community in the west of our county where that happened, and my children both got anti-Semitic bullying as a result. We have 21 active measles cases in Rockland County right now. We need to maintain a strict vaccine schedule. It's very important. And so, yeah, firing RFK would be a start, and making sure that in New York State, if we can take additional measures to keep vaccine requirements as high as we can, hopefully that will stop the numbers from going in the wrong direction.
Totally agree here. The problem is at the top. We have a Health and Human Service Secretary who has a brain worm. And yet we all look at him as though we're going to expect some kind of logical or usable stuff to come out of that office. Nothing's gonna, I hesitated, I didn't want to curse yet again. Nothing good is gonna come from that. We need to get rid of him. It's what happens when you have a Senate not doing its job, when you have nobody standing up and saying, this guy's not qualified. We need to have a qualified government. We need to get back to leading based on actual data, and we need to be providing that data. The US government has also got out of the business of being the official source of data, and that's a problem. We need to get back to that, and that would restore trust. People need to see what decisions are being based on, and then we'll restore faith in government.
Thank you.
It's going to be our job in the House to be the opposition party. Not just the other party, but the opposition party. It's going to be our job in office to articulate what we stand for strongly and clearly and forcefully. We are going to stand for making sure that we have a strong vaccination schedule, that even if RFK or whomever's in office then is denying it, at least people will know that we are fighting for them. Hold hearings. Bring in the bad guys. Show the victims of those bad guys. Make people see what has been happening in their names. Shame this administration for its bringing back diseases that we had thought we had eradicated because what? Trump decided to abandon the one good thing he did during his first term, which was actually have a COVID vaccination roll out in warp speed and then even an operation after. Because what? RFK and a bunch of lunatics were too busy saying that COVID didn't exist? Come on. We can bring this back. We can bring the messages back. We can bring the information back, and we can show that we are fighting for our children's health.
Thank you.
I think to start, to bring back trust, we have to be serious, right? We have to have a government that's serious. Let's rely on science. Let's rely on expertise. Let's talk about these issues in a serious manner. Suggesting, for example, suggesting nurses are not professional, right? Last year, health professionals made up at a 4.4% unemployment rate, approximately, made up 95% of new jobs created last year. Of the 700,000 jobs, the first quarter, 400,000 of those were healthcare professionals. Not only is it indignant that it affects our economy, right? The fact that they're not considered professional has a practical effect. They are no longer allowed certain grants and scholarships to pursue their education. What is that going to mean? Less healthcare professionals. How is that serious? How does that help us achieve the results we want to achieve? So I think being serious will help us to regain a little bit of trust.
Thank you, John.
So my last 4 years in public service, I worked with members of Congress. I worked with committees. I have written federal legislation. I have overseen and executed national budgets on issues that were critical to keeping everyone in this room and American families across this country and across the world safe and secure. I know how Congress is supposed to do its job. I know how the federal government is supposed to do its job. I know how to work to fix this because it is about action. Action is what brings trust to institutions, to the people in offices. It is doing the right thing. And so I do know how to make Congress work, if elected as your member sitting in there, to actually bring these agencies back under control to do their jobs. Look, health is national security. We need to treat it that seriously, and we need to solve these problems that seriously and that urgently.
Thank you so much, Cait. So this is a last question, and I'm going to give you a minute because I'm also going to read Effie's letter that she submitted tonight to think about it. Candidates, I would like to end this evening as we started with tremendous appreciation for each of you and your service to our community by undertaking such grounded, values-driven campaigns. In our remaining time, I ask that each of you not just reflect on your records of service, but share more about your commitment to service in the district. In the case you do not win the primary or general election, how do you see yourself continuing your service to our district and the thousands of residents you've each met come 2027? And while you mull on that, I do want to quickly read a note from Effie. I share my deepest regrets for not joining you at this evening's forum. I'm currently on a plane traveling to Israel and the West Bank on a fact-finding trip that is entirely self-funded. I'm going to read an excerpt and we're going to share the link. My healthcare platform is very clear: Medicare for all. Our health system today is a patchwork of disjointed policies that remain after Republicans stripped away all of the progress made under the Affordable Care Act. It's a system that prioritizes the needs and profits of insurance companies and Wall Street over the human rights of every American. It is too expensive, too inequitable, and not centered on caring for people. After the Republicans' Congress indefensible votes to slash Medicaid and eliminate the Obamacare subsidies, I believe our system has become so untenable that we must rebuild it in a way that centers quality care for all, not profits. My vision of Medicare for All is a national healthcare system where coverage is guaranteed to every resident with a Social Security number. This would lift the financial burden that families, individuals, and small businesses carry from massive premiums and out-of-pocket costs. Skipping ahead, having lived with my family under a single-payer system in the UK for 4 years, I can attest this is not a radical idea that is unattainable in the world's wealthiest country. We will share the letter in full, and Effie very much regrets not being able to join us tonight. And I would love to move down the line with 1 minute each for your closing thoughts on your commitment to service to our district come 2027.
Thanks, and thanks for putting this together. So, look, everything we talked about tonight, no offense, but we didn't talk about the most important question, which is how do we beat Mike Lawler? None of what we talked about tonight matters if we don't win. Because if we don't win, we don't get to govern. And if we don't get to govern, we don't get to fix this. And so I will tell you, I think tonight, to end this, we need to focus on what is going to actually change all of the problems we just talked about, which is getting actual leaders of character that can beat Mike Lawler into office to set this country on a better path. And that is where I do believe, look, we have watched Mike Lawler take on and defeat 2 Democratic politicians. If you want a different kind of outcome, I think you need a different kind of Democrat. A Democrat that can inspire people to choose a person instead of a party. Because, ladies and gentlemen, NY-17 today, 28% of registered voters are unaffiliated. If we want to win, we've got to get more than people in this room to choose us for that path forward, and to show them that we have a better option than just Mike Lawler.
Thanks.
Thank you again, Kevin, and thank you all for being here. This has been a really great evening, and I look forward to getting to speak with you and learn more. Look, we need to restore balance and accountability to government, to Congress, and that means 5 things that need to be done simultaneously. We need to impose term limits, have a real conversation about what that looks like and what that means. Campaign finance reform, Citizens United needs to be on, and we need to restore campaign finance sanity. There needs to be a moratorium on members lobbying after they leave office, minimum of 5 years. We need to have that conversation. Members should not be able to trade stocks. This is kind of common sense while they're in office. And then finally, some sort of code of ethics, potentially even a term limit for the Supreme Court. These 5 things have to happen. We have to talk about these things, and that will restore the balance to our Congress and the accountability.
Thank you. I will get by something to anyone who answers my question.
Yeah, I'm about to. Thank you. It's tempting to give my closing peroration, and I have one. I'm happy to give it to everyone afterwards. But I, win or lose, will be in this district no matter what. My family moved up here in 2018 after I had covered Congress, the Supreme Court, the 2016 campaigns, the White House. Okay, that's part of my closing peroration. And we fell in love with this area, its natural beauty, the people in our neighborhood, the schools my kids are in. I'm not going anywhere. And part of the education of being a candidate is also meeting everyone who shows up every single day to fight for our rights and liberties and freedoms in this country, to fight for our neighbors. We see it every week, either at the Four Corners in Nanuet or at the in Mount Kisco by the town hall. We see it with the No Kings Days. We see it just with everyday people just asking, "How are you doing?" And then people saying, "What are you going to do about Mike Lawler?" Because people have united against him. What he has done, he's offended everyone he's purported to serve who isn't fully bought into a cult.
Thanks.
And there's going to be more of us than there are of them. And I look forward to being part of us and also serving them.
Thank you.
I got it. I got it. I'm a lifelong Democrat. I've lived here my entire life. I moved here when I was 9 months old. I've spent the last 31 years.
Here at 9 months.
I was moved here at 9 months old. I've spent the last 31 years in Briarcliff. I have spent my entire adult life dedicated to giving back to my community. I was elected mayor 20 years ago. I've been elected 5 times. My district is 30% Republican, 40-ish Dem, 30% independent. It's probably 30 at this point. It basically mirrors 17 as a whole. I've always served in a voluntary capacity, never paid $1 for this. It's been thousands of hours, and I've worked with everyone across the political spectrum. We need to get back to actually doing things in Congress. We need to get the money out of Congress. We need to get people in there who want to work together and make progress for the only people who count, all the constituents who live in 17, not big business, not special interest groups. That's what my goal is, to get in and represent all of you the best I can.
Thank you.
Thank you so much, Bedford Dems. Thank you, Kevin. Thank you for everyone who came out to spend your Wednesday night. Come January 2027, I will, regardless, be serving, I think, my 5th term as a committee member of the Clarkstown Democratic Committee, which I proudly served for almost 10 years, I think. But I'm going to close tonight with asking a question that you should be asking everyone that runs for any office, and I certainly get on the campaign trail, and that's what gets you out of bed every day to do this work. For me, it's always been the people I represent on the county legislature, the people I represented on the Nyack School Board, the 200 people inside the county legislative chamber last night, including John Sullivan. Thank you for being there last night. And the 300 more outside, all lifting their voices in support of my Dignity and Safety for All Act, which will protect all Rockland residents from the cruelty and barbarism of ICE. Mike Lawler will always stand with Donald Trump. He'll always stand with Kristi Noem, with Mike Johnson. I will always stand with the people. That's why I'm the best person to beat him in November, which we will do together. Flip New York 17 and put Congress back to work. Say it with me, for the people. Thank you very much.
Thank you. So my friends, a former president and New Yorker once shared, the government is us. We are the government, you and I. And I ask each of us to remember that it does not need to be like this. It does not need to feel like this every morning. Every morning. There exists in America, in our communities, in this room, and on this stage, tremendous capacity for compassion, for candor, and for change. And it starts here as good as anywhere. Our task, our one home, one door, one conversation at a time. To reconnect, to rethread, to remind each other of our common concerns and greater purpose. Bless you and your families and all those willing to stand up and step up and lead. Please join me in thanking our candidates and everyone who made today possible.
And thank you, Cait Conley, John Cappello, Mike Sachs, Peter Chatzky, Beth Davidson, and our moderator, Kevin McAvey. Come on. And the BDC team, Jennifer Saine, Paul Esposito, Chris Vecchio, and our amazing director who did all of her direction from down in Florida. Yes. All right.